So does sleep really matter? I'm assuming if you're kind of watching this video, you've probably already figured out that sleep is kind of a big deal. It impacts not only our daytime behavior, it impacts our health, everything about our lives. Sleep is starting to impact, and the quantity and quality of sleep that we get is kind of a big deal. So what happens if maybe just 1 or 2 nights of sleep, maybe 3 or 4, maybe just a couple of weeks of not getting the sleep that we need? Is that a big deal? And the answer is yes, it is. It really is a big deal. But what I want to assure you of, because this is the thing that my patients always come to me and say, listen, I was told if I don't get sleep, I'm going to, and you can put anything in there, lose my job, I'm going to get cancer, I'm going to get diabetes, I'm going to increase weight. And that insomnia brain that you start having around that, and the worry you have around your sleep and ability to get sleep, is going to impact your sleep as well. So I only give you these because I think it's important to maybe say, listen, if you're experiencing some of these symptoms, it may be related to your sleep, but be assured, using cognitive behavioral therapy for insomnia, we can start solving some of those sleep problems. So I'm only showing you these because I want you to understand there may be some of those health issues that you have are related to the fact you're not sleeping very well today. So short-term sleep loss, probably one of the easiest ones for us to think about is decreased performance and alertness. We know that if we've not had or we've just not been able to sleep very well, maybe stayed awake all night, or we're working late into the evening, we know that our ability to perform and to be able to do the tasks that we need to do begin to start to go down. We know that driving a car becomes difficult, our reaction time gets slower, and those type of things. So we know that lack of sleep or just not getting the quantity and quality that we need will impact our performance and our alertness in that daytime. We all know that alcohol actually impacts our performance, and none of us would actually get in the car, put our child in the back, and probably go to a bar, maybe drink a 6-pack of beer, and then drive our child home. We know that's probably not a good thing to do because our reaction time is pretty poor during this period of time. But did you know that actually sleep loss looks just like alcohol in our system? If we're not getting the sleep we need, our ability to perform, our alertness, our ability to break, our ability to react to things in our environment go down just like we've had alcohol and are drunk. So we need to make sure that we're really wide awake and alert. Don't drive with your kids at 3 or 4 o'clock in the morning trying to get somewhere overnight. Get the sleep that you need. There's another thing around memory deficits, and we may notice as we're getting a little bit older that, listen, man, I just don't remember when I read a book, I don't remember the last page. When I read a magazine, I don't remember maybe paragraphs at a time. And we start noticing these memory deficits that happen as we grow a little bit older. What they actually found is that for older people who are having a little bit of cognitive decline or a little bit of memory issues, not necessarily full Alzheimer's disease, but they're starting to have some cognitive decline, that with these patients that they were able to give them supplemental melatonin. This supplemental melatonin helped them because we produce melatonin at night in a dark environment, and that's one of the things that help us fall asleep and maintain sleep. So what they were able to do is give these older patients who are starting to have some cognitive decline some extra melatonin, and what they found is their cognitive decline started to decrease. So we know that sleep is important for our memory and being able to remember new things, being able to remember some old things as well. There was some new research that was out that looked at cognitive decline associated around memory deficits associated with Alzheimer's disease. And what we do know that patients who have Alzheimer's disease is that they have a buildup of amyloid plaquing and tau proteins in their brain. And what we found out is that during sleep, or especially delta sleep or slow wave sleep, we have this system, what we call a glymphatic system. And the glymphatic system is there for the brain to wash out some of the tau proteins and other neural wastes that are associated with that. And during deep sleep, we need to make sure we're getting the sleep that we need, or we're going to start to see some cognitive decline associated around that. A lot of times my patients say, Robert, so what is actually a great position to sleep in at night? What's good, what's bad? Well, interesting thing around this glymphatic system, we know that lying on your side, especially in the left side laying position at night, this is the best position for your glymphatic system to work. Now, it works in any position that we sleep in, but be assured that if you want the best, it's actually in that left lateral position. So we started talking about memory decline associated with Alzheimer's and those type of things, and we started looking at cognitive impairment. That's just our ability to reason. That's what we as higher functioning human beings do. That's what happens in the front part of our brain. It allows us to say, listen, I know that I need to make a left 3 stoplights down, so I need to start getting in the left-hand lane. It allows us to do math problems. It allows us to do all this reasoning. So there was a doctor, Dr. Dinges said, you know what, if the whole population is starting to look at just getting 6 hours of sleep per night, and that's about where people are starting to go. It's just about 6 hours of sleep per night. He said, if that's all people are going to get, what happens to cognitive thinking if they're only going to get 6 hours of sleep? And what Dr. Dinges found out is that if you only get 6 hours of sleep for 2 weeks, not 2 months or 2 years, but if you just choose to only get 6 hours of sleep, which is not enough for just 2 weeks, they had the same cognitive decline as someone who stayed awake for 2 whole nights. Now, I don't know about you, but I don't think I want a surgeon working on me that has been awake for 2 whole nights. I don't want a truck driver coming down the road at me at night or in the daytime or anytime that's been awake for 2 whole nights. I don't want an accountant doing my accounting work who's been awake for 2 whole nights. So it's important that we get the sleep we need. You may think you're functioning well on 6 hours of sleep, but you just don't know what it feels like to be normal again. Decreased ability to deal with stress. You've had your boss who just seemed to blow up all the time. Any little stress at all in their lives and they blew up. We know that people who don't sleep very well, they just don't deal with stress in their environment. And you've probably felt that too. If you've been a young parent and your child acts out and you haven't had the sleep you need, you can react rather than thinking about what you need to do. There's also things around anxiety as well, that we know that people who don't sleep very well, the parts of their brain that are responsible for thinking around anxiety, we see heightened areas just by not getting enough sleep. So when anxiety comes into their life or stressors come into their life or anything like that, then we overreact to that anxiety and we feel that anxious event associated with that. And then there's just poor quality of life. If you're not sleeping very well, we just don't feel good. How many of us have said, I don't feel like, and you can answer that any way you want. I don't feel like going to exercising. I don't feel like cooking tonight because I'm just too tired. Those are not great things. And then there's occupational injury. We know that a lot of times, whether it's an airplane accident, a train wreck, or a car wreck, a lot of times associated with just not getting the sleep that we need. Automobile injuries are quite common, and there's times of the night like that 3, 4 o'clock in the morning where we start to see accident rates go up associated with people who are just sleep deprived and not sleeping very well. So that's kind of the short-term sleep loss. That's about up to a couple of weeks of not getting quantity and quality of sleep. So now let's look at long-term sleep loss. Let's look at what happens after 4 weeks or longer of not getting the sleep that you need. The first up on the list is actually high blood pressure. And people go, really, Robert? So you're going to change high blood pressure by just allowing someone to get the sleep we need? And the answer is yes. We can put patients on who have sleep apnea. We can put them on a CPAP, BiPAP, and an AutoPAP. We can treat their sleep apnea, and we actually start to see high blood pressure go down. Another one is around heart attacks. And for a long time, we knew there was a correlation between lack of sleep, lack of quantity and quality of sleep, and heart attacks. And what they did is they did a study, and they said, well, let's look at just maybe 1 hour of sleep loss. Just 1 hour of sleep loss, could it really impact the rate of heart attacks? So they looked at an entire country, and they said when they lost 1 hour of sleep associated with a change in a clock that happens in the springtime, so we change the clock, we spring it forward, so we lose an hour of sleep. They looked at heart attack rates at the next entire week to see what heart attack rates did that entire next week. And what they found is that entire next week, heart attacks went up. The rate of heart attacks went up throughout the entire country. Now then they said, okay, so if a heart attack can happen with just a 1 hour loss of sleep, what if I give you an extra hour of sleep? What's going to happen then? And actually what we found is heart attacks went down the week after we actually get an extra hour of sleep in the fall. When we turn the clock back, we get an extra hour of sleep, and suddenly heart attack rates go down. We now know that it's probably associated with inflammation, that we notice that patients that are not sleeping well, whether quantity or quality, we see higher levels of inflammation. Higher levels of inflammation are what puts us at risk of having a heart attack associated with that. And then we have this thing called a stroke. And you go, wow, really? You increase your risk of stroke? Yes, you do. You actually increase your risk of stroke. And it's all around that fact that if I have this higher levels of inflammation, it's going to put me at higher risk of having a stroke, just like having a heart attack. And then we know that obesity is rampant in the US today. We know that not only in the US, but it's across the world. We see more people being obese. And there's a couple of things that happen. What we see with patients who are not sleeping very well, again, quantity, quality, we see changes in what's called leptin and ghrelin. Leptin and ghrelin are appetite control hormones, and it says whether I'm hungry or I'm full. And we see an imbalance in that if we're not sleeping well. The other thing that we see that we now know through all the new research that's coming out now, that changes in inflammation will actually change our ability to regulate glucose very well. And when we don't regulate glucose very well, it puts us at a higher risk of obesity as well. And then there's a thing called depression. We know that people who just don't seem to sleep very well, they have higher risk of depression. And we say, boy, I don't understand that. You know, what's going on in their lives that's causing them to be depressed? There's a lot of things that can happen. I'm not saying that sleep is the only thing that happens, but depression can be caused by lack of sleep. We see, again, around inflammation, people don't sleep well, have higher levels of inflammation. Now we know there's a direct correlation between high levels of inflammation and depression. And then there's a thing called ADD, ADHD, attention deficit disorder, and it's kind of a hot topic today. But what we do know is that children who don't sleep very well, because again, either they're up late doing schoolwork, they're up doing watching television, working on their computer, or whatever it is, but children today are not getting enough sleep that they need. We're starting to see children getting 1 to 2 hours less sleep than what they should actually be getting. And what we see with that is those children who aren't getting the sleep that they need, they actually have the same type of behaviors in the daytime as someone who has ADD, ADHD. So some of the people, not all kids, but some of them may just need to get a little extra sleep, and we'll see those symptoms start to subside. And then there's disruption of bed partner's quality of life. We know that if one partner isn't sleeping well, oftentimes it disturbs the partner next to them. And there's a whole new trend out there that comes around on occasion. It's called bedroom divorce or sleep divorce, where we're taking couples who one of them is not sleeping well and they're moving them to the other room. And it's most often associated with snoring, which that snoring is oftentimes associated with sleep apnea. I say let them sleep together. Solve the sleeping issue so that they can sleep in the same bedroom. Don't send them off to another bedroom. We need to stay together. And then there's this whole thing around a decreased immune response, that people who don't sleep very well, they're actually, if they're getting 7 hours or less per night, they're 3 times more likely to get sick when exposed to a cold virus. All of us are exposed to cold viruses. Most of us can fight it off. But if you're not sleeping very well, it's actually going to cause issues with you about fighting off those infections. And then increase in pain. We talked about inflammation already, and we see that with increase in inflammation in the body, it increases joint pain. So maybe now you're starting to have shoulder and hip pain that you've never had before. Maybe it's neck pain, maybe it's hand pain, but it could be associated with that whole levels of increase in inflammation. And actually some research out of university in Israel actually showed that if they decreased quantity and quality of sleep in people that had no symptoms of pain at all, they just looked to see what was going on in their lives. If I decrease your quantity and quality of sleep, what symptoms do you have? And one of the most common ones they had was actually low back pain. So people who had never experienced low back pain, which is about 70% of the population at one time or another is going to experience low back pain, it was actually due to their lack of quantity and quality of sleep. And then there's some interesting research looking at nighttime eating behaviors and maybe even breast cancer, is that they looked at, and we know this intermittent fasting that's going on today is kind of a popular fad. And there's been some interesting research out of the University of California that looked at eating regular meal times, but then waiting longer between dinner and breakfast. And what they found is that for every 3 hours of extra fasting at night, a female or woman was to get, it decreased her likelihood of getting hyperglycemia by 20%. And hyperglycemia is associated with a higher risk of breast cancer and diabetes. So we want to make sure we don't do that nighttime snacking that a lot of people do, either prior to going to bed or in the middle of the night. Don't get up and eat. We like that intermittent fasting. Not only is it good for sleep, but it's also good for a lot of risk factors associated with cancer and those type of things and diabetes. And we just know that just overall, if you're not getting the sleep that you need, we see a higher risk of type 2 diabetes, which is very common today. We're starting to see a lot more type 2 diabetes than we've ever seen, not just in overweight older individuals, but in younger individuals, even getting down to their teens, we're starting to see type 2 diabetes associated with that. One of the things we do know around cancer and sleep, we know that females who have had a history of breast cancer, if they don't get the sleep that they need after they've been treated for breast cancer, their risk of getting breast cancer in the future increases if they're not getting the sleep that they need. There's also another thing that they've looked at, and this is a gene called the HPER2 gene. Now, the HPER2 gene is associated with our circadian rhythm, but it also protects us against cancer development. And what we've seen is that people who are not getting the sleep that they need have lower levels of this HPER2 gene, and it increases their risk of cancer overall. So I know we've gone through a lot. I know we've talked a lot about maybe some of the dangers associated with, of not getting the sleep that you need and some of the things that could happen associated with that. Please be assured, again, that we're going to work with you to help solve these issues so that you don't have to worry about getting these things. We don't want you to develop an insomnia brain, what we call, where you worry about all of these diseases if you're not going to get the sleep that you need. That's why we're here. CBTI, cognitive behavioral therapy for insomnia, has been shown to help us solve these sleep problems so we don't have to worry about these health issues associated with not getting the sleep that we need.